10 silent signs of colon cancer your body is desperately trying to show.
What if your body was trying to warn you about cancer right now? Would you know how to recognize the signs before it was too late?
What would happen if you kept ignoring those seemingly harmless symptoms? Colorectal cancer is the third leading cause of cancer death in the United States, affecting more than 150,000 Americans annually. However, when detected early, survival rates are as high as 95%.
Every signal your body sends can be the difference between life and death.
Unfortunately, many people continue to ignore these crucial signs until the cancer is already at an advanced stage.
Knowledge is power, especially when we talk about our gut health. Let's get started. The invisible threat: why colon cancer is attacking younger and younger Americans. Colon cancer is no longer a disease exclusive to the elderly.
Alarming statistics show that cases in people under the age of 50 have increased dramatically over the past 2 decades.
Doctors across the country are baffled by the growing number of young patients in their offices. In 2023, more than 18,000 Americans under the age of 45 received this devastating diagnosis. The average age of colorectal cancer patients decreased from 62 to 49 years in just 1 generation. Many experts believe that changes in lifestyle and modern nutrition are fueling this silent epidemic. The excessive consumption of ultra-processed foods, sugary drinks, and processed meats has turned our intestines into a breeding ground for cancer. Chronic sedentary lifestyle, the result of endless hours in front of screens, is further aggravating this worrying situation. The gut microbiota, our natural protective shield, is being decimated by antibiotics and food preservatives. But there is hope on the horizon for those who know the signs and act quickly. Are you ready to find out what your body might be trying to tell you? The hidden triggers. Who is really at risk of developing this disease? Not everyone has the same risk of developing colorectal cancer. Some factors significantly increase your chances of facing this diagnosis at some point in life. Aging remains a major risk factor, with the risk increasing considerably after the age of 50. However, as we mentioned earlier, age is no longer a guarantee of protection against this disease. People who are overweight or obese face a 40% higher risk due to the chronic inflammation that these states cause. Adipose tissue releases inflammatory chemicals that directly damage the DNA of colon cells. A sedentary lifestyle is another silent factor that increases the chances of developing precancerous polyps by up to 60%. Smokers have almost twice the risk compared to non-smokers, even if the cigarette does not come into direct contact with the intestine. Regular alcohol consumption, especially more than 2 drinks a day, significantly increases the risk of developing colon damage. The diet low in fiber and high in saturated fats creates a perfect environment for the emergence of cancer cells in the intestine. Are you making daily choices that increase your risk without realizing it? Treacherous DNA. When your family history can be a death sentence, your genes may be hiding a deadly secret that you are completely unaware of. Approximately 30% of colorectal cancer cases have a familial or hereditary component. If you have a first-degree relative with a history of colorectal cancer, your risk doubles instantly. With 2 or more family members affected, their risk can triple or even quadruple, depending on the age at which they were diagnosed. Certain genetic syndromes, such as Lynch syndrome, can raise your risk to a staggering 80% over a lifetime. These genetic changes can go unnoticed for generations until a diagnosis reveals the familial pattern. Individuals with chronic inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, face an even higher risk. Chronic inflammation of the gut, maintained for years or decades, can permanently damage the DNA of intestinal cells. People of African American origin are 20% more likely to develop this cancer compared to other ethnic groups. Do you know your family's full medical history? Or are you blindly navigating your actual risk? 1. The secret code of the gut. Changes that reveal a mortal danger. Your gut follows a unique pattern that you know better than anyone. Any persistent change in this pattern,
especially if it lasts longer than 2 weeks, deserves immediate medical attention.
Alternating episodes of diarrhea and constipation, for no apparent reason, can be one of the first signs of a colon tumor. A bowel pattern that changed dramatically without changes in diet or medication is particularly suspicious.
The sensation of incomplete evacuation, even after several attempts, may indicate a tumor partially obstructing the intestine. The intestine has its own nervous system with more than 100 million neurons that detect microscopic changes before any medical examination.
The urgent need to have a bowel movement that wakes you up during the night should not be normalized or ignored.
More frequent bowel movements, especially more than 3 times a day without change in diet, deserve investigation.
Sudden constipation in someone who has always had regular bowel may be the first visible sign of a growing tumor. What is your gut trying to tell you that you keep ignoring out of embarrassment or lack of information?
Don't let the taboo about bowel issues put your life at risk unnecessarily.
2. Telltale format: how your stool is screaming for help. The appearance of your stool may hold crucial clues about your gut health. Stools thinner than a pencil, especially if this change is consistent, may indicate a tumor narrowing the intestine. Flattened or ribbon-shaped stools can be caused by tumor masses pressing on the colon. The presence of excessive mucus in the stool, especially if it is a new phenomenon, should be reported to your doctor.
Each abnormal shape in the stool represents a coded message that your body is sending about something wrong in your gut.
Stools that are too dark or tarry-like may indicate bleeding in the upper digestive tract. Undigested fragments of food in the stool can be signs that a tumor is interfering with proper absorption. Changes in color, consistency, and odor that persist for more than a few days deserve medical attention. Excessive fluctuation of the stool, or difficulty flushing, may indicate changes in fat composition related to tumors.
These changes are often the first visible signs long before more severe symptoms manifest. Have you noticed any of these changes and dismissed them as temporary or unimportant?
3. Red warning spots: the sign that should never be ignored. Blood in the stool is never normal, regardless of the amount or frequency.
The presence of bright red blood on toilet paper or toilet water may indicate rectal bleeding. Even small amounts of blood, the size of a droplet, deserve immediate medical investigation.
Blood mixed with the stool, giving it a marbled appearance, is particularly worrisome and characteristic of tumors in the colon. Colorectal tumors are highly vascularized and bleed easily when stool passes, producing the most direct warning signal your body can send. Bleeding can be intermittent, appearing and disappearing for weeks or months before becoming constant. Many people mistakenly attribute bleeding to hemorrhoids, missing precious opportunities for early diagnosis.
Painless bleeding is the most dangerous, as it does not motivate the person to seek medical help immediately.
The color of the blood can indicate the approximate location of the problem. Bright red suggests origin in the rectum or lower colon.
Have you ever observed blood in your stool and decided to wait to see if it disappeared on its own?
4. The silent pain, when your abdomen is begging for attention. Persistent abdominal pain, even if mild, should not be masked with painkillers without investigation. Discomfort in the lower left region of the abdomen is particularly suspicious for tumors in the sigmoid colon. Pain that worsens after meals may indicate that a tumor is partially obstructing the passage of food.
Intense cramping followed by relief after bowel movement can be caused by tumors that alter intestinal peristalsis.
Colorectal cancer pain often manifests as a constant pressure that many mistake for irritable bowel syndrome. Persistent bloating, especially if accompanied by other symptoms on this list, deserves medical attention.
Aches and pains that wake you up at night are particularly worrisome and rarely related to benign conditions.
The location of the pain can change as the tumor grows and puts pressure on different abdominal organs and nerves.
Many patients report an undefined feeling that something isn't right long before they develop significant pain. Have you been ignoring that persistent abdominal pain, attributing it to stress or eating? 5. Stomach upset, nausea, that hides something much more serious.
Chronic nausea with no apparent cause can be an early sign of a colon tumor. Recurrent episodes of vomiting, especially if they occur without other symptoms of infection, merit investigation. The constant feeling of an upset stomach, especially after meals, may indicate partial intestinal obstruction.
Morning nausea that is not related to pregnancy or hangovers can be caused by tumors releasing toxic substances.
Advanced tumors in the colon can release proteins that directly activate the vomiting center in the brain, creating constant nausea with no apparent digestive cause. Sudden aversion to foods you've always enjoyed may be a mechanism for protecting the body against cancer.
Food intolerances that appear suddenly in adulthood may be related to changes in the intestinal mucosa.
These symptoms are often confused with gastritis or irritable bowel syndrome, delaying the correct diagnosis. Nausea that progressively worsens over weeks or months, rather than getting better, is particularly worrisome. Have you been self-medicating your nausea with antacids and over-the-counter remedies without investigating the real cause?
6. Appetite in free fall, the symptom that everyone mistakes for stress.
Unexplained loss of appetite, especially if progressive, should never be ignored.
The feeling of fullness after just a few bites can be caused by tumors releasing substances that affect the hypothalamus.
Sudden aversion to certain foods, especially red meat, can be a defense mechanism of the body. Disinterest in foods you've always loved can be one of the first neurological signs of colorectal cancer. Cancer cells secrete inflammatory proteins that travel through the bloodstream to the brain, directly altering its hunger and satiety centers. The need to force yourself to eat, when you once enjoyed mealtimes, deserves medical attention.
This loss of appetite usually occurs months before other, more obvious symptoms manifest. Many people mistakenly attribute lack of appetite to stress, anxiety, or depression, delaying diagnosis.
The combination of loss of appetite with any other symptom on this list significantly increases the likelihood of cancer.
How long has it been since you have actually felt hunger or pleasure in a full meal? 7. Mysterious weight loss. Why losing weight? Effortlessly can be fatal.
Losing more than 5% of body weight in 6 months without diet or exercise is a red flag.
Many people celebrate this miraculous weight loss without realizing that it can be a serious symptom. Clothes that are suddenly loose, belts that need new holes, rings that slip from the fingers are worrying signs.
Colorectal cancer robs your body of essential nutrients, causing loss of muscle mass before fat. Weight loss caused by cancer is particularly dangerous because it first affects muscle mass, including the heart, long before consuming fat stores. This weight loss occurs even if the person maintains the same eating pattern as always. The accelerated metabolism is caused by inflammatory substances released by the growing tumor. The combination of weight loss with persistent fatigue significantly increases the likelihood of colorectal cancer. Many patients report being praised for their weight loss, only to discover the grim cause later.
Have you been celebrating your unexplained weight loss without questioning what might be causing this miracle? 8. Unexplained tiredness. When your life energy is being stolen. Cancer-related fatigue is different from normal tiredness. It doesn't improve with rest or sleep. This deep exhaustion affects your ability to perform even the simplest everyday tasks. Feeling completely drained after minimal activity can be a sign of anemia caused by chronic intestinal bleeding. Many people attribute this fatigue to aging, stress, or overwork, postponing the necessary medical appointment. The extreme tiredness caused by cancer occurs because tumor cells sequester glucose and nutrients from the bloodstream before their vital organs can utilize them. The need for naps during the day, when this has never been your standard, should light up an alert. This fatigue often sets in gradually over months, becoming the new normal almost imperceptibly. The combination of fatigue with pallor, shortness of breath on exertion, and tachycardia suggests significant anemia. Many people report feeling like something is draining their energy. An accurate description of what's really going on. Have you been taking more coffee, energy drinks, or supplements to combat a tiredness that just doesn't go away? 9. Diluted blood, concentrated danger. The anemia that announces cancer.
Iron deficiency anemia is often the first detectable sign of chronic intestinal bleeding. Abnormal pallor, especially in the conjunctivae, palms, and under the nails, may indicate low hemoglobin levels. Dizziness on standing up quickly, ringing in the ears, and blurred vision are neurological signs of significant anemia.
Intense cravings for ice, dirt, or other non-food items, pica, can be symptoms of severe anemia.
Anemia caused by colorectal cancer is particularly insidious because bleeding is so slow and gradual that the body adapts, masking symptoms until hemoglobin levels are dangerously low.
Brittle nails with a concave shape, koilonychia, are visible signs of prolonged iron deficiency. Excessive hair loss, especially if accompanied by fatigue, can be a result of iron deficiency anemia. The intense desire for red meat may be an attempt by the body to replace iron lost through bleeding.
Many people, especially women, normalize their anemia by attributing it to menstruation or improper diet. When was the last time you checked your iron and hemoglobin levels on a blood test?
10. Compromised breathing. Your body's last cry for help.
Shortness of breath during everyday activities that were once easy can be a sign of severe anemia due to intestinal bleeding.
The need to stop to breathe after climbing a flight of stairs may indicate that your blood is not transporting oxygen properly.
Rapid, shallow breathing, even at rest, may be an attempt by the body to compensate for anemia. Heart palpitations and rapid pulse are compensatory mechanisms for reduced oxygen carrying capacity. Dyspnea caused by colorectal cancer often precedes diagnosis by almost 6 months and is mistaken for heart or lung problems. Waking up during the night with a feeling of suffocation can be caused by severe anemia affecting breathing during sleep. Difficulty in performing physical activities that were previously routine should be investigated, not only attributed to aging. The combination of shortness of breath with any other symptom on this list significantly increases the likelihood of cancer.
Many people receive treatments for asthma or heart problems when the real problem is in their colon.
Have you been limiting your physical activities to avoid the uncomfortable feeling of not being able to breathe properly? Poisons at the table. The foods that are feeding your cancer without you knowing it. Your refrigerator and pantry may contain real time bombs for your colon. Processed meats like bacon, ham, sausage, and sausage increase the risk of colorectal cancer by up to 40%. These products contain nitrates and nitrites that turn into carcinogenic compounds called nitrosamines in the gut. Red meats grilled at high temperature produce heterocyclic amines and polycyclic aromatic hydrocarbons, potent carcinogens. A daily serving of just 50 grams of processed meat, equivalent to 2 slices of ham, increases the risk of colorectal cancer by 18%. Ultra-processed foods, packed with preservatives, emulsifiers, and artificial colors, damage the protective gut microbiota. Sugary drinks and foods with a high glycemic index feed cancer cells and promote chronic intestinal inflammation. Processed trans fats, found in many convenience foods, are particularly harmful to the intestinal mucosa. Low levels of vitamin D, common in people with diets low in fatty fish, eggs, and sun exposure, increase the risk. Are you unconsciously feeding cancer cells at every meal? The 30-minute exam that can add 30 years to your life. Colonoscopy is currently the most effective method to prevent and detect colorectal cancer early. This procedure allows you to directly visualize the entire large intestine and remove polyps before they become cancerous. Performed under sedation, the procedure is practically painless and lasts approximately 30 minutes. Exam preparation, while uncomfortable, is a small price to pay for the potential to save your life. A single colonoscopy can reduce your risk of death from colorectal cancer by up to 68% for more than 10 years. Currently, it is recommended that people at average risk start screening at age 45, not 50. People with a family history should start screening 10 years before the age at which the family member was diagnosed. Individuals with high-risk genetic syndromes may need to start screening as early as adolescence. Fear and embarrassment prevent many people from taking this potentially life-saving test. Are you risking your life for the embarrassment of a procedure that can be the difference between life and death? Quiet revolution. The new weapons in the war against colorectal cancer. Modern medicine is transforming the diagnosis and treatment of colorectal cancer.
Less invasive tests, such as searching for tumor DNA in feces, allow cancer to be detected in early stages without colonoscopy.
Blood tests capable of identifying fragments of circulating tumor DNA are revolutionizing early diagnosis.
Virtual colonoscopy, performed by CT scan, offers a less invasive alternative for some patients.
Modern targeted therapies can identify specific mutations in each patient's tumor, allowing personalized treatments that attack only cancer cells while preserving healthy tissues. Innovative immunotherapies are helping the immune system itself recognize and destroy cancer cells. Minimally invasive surgeries allow for the removal of tumors with minimal incisions and much faster recovery.
Precision radiation therapies can now target tumors with millimeter precision, reducing damage to healthy tissues.
Studies with artificial intelligence are making it possible to identify risk patterns invisible to human eyes in imaging exams. Monitoring of tumor biomarkers allows you to track treatment response in real time, adjusting therapies as needed. Each innovation brings us closer to the day when no lives will be lost to this highly treatable cancer. Are you taking advantage of these extraordinary medical advancements or letting fear keep you away from them? The Protective Shield. 7 strategies to shield your colon against cancer. Colorectal cancer prevention is literally in your hands and in your daily choices. Significantly increase fiber intake through fruits, vegetables, legumes, and whole grains. Fibers sweep carcinogens from the gut and feed the beneficial bacteria that protect your intestinal mucosa.
Drastically limit the consumption of red meat to a maximum of 2 weekly servings of 150 grams each.
Regular moderate-intensity physical activity, such as brisk walking for just 30 minutes daily, can reduce your risk of colorectal cancer by up to 25%.
Maintain a healthy weight, as every 5-point increase in body mass index increases your risk of colorectal cancer.
Limit alcohol consumption to a maximum of 1 daily drink for women and 2 for men.
Quit smoking completely, which increases the risk of not only lung cancer, but also colorectal cancer.
Maintain adequate levels of vitamin D through moderate sun exposure and a diet rich in this essential nutrient.
Include calcium-rich foods in your diet, as this mineral binds to potentially carcinogenic substances in the gut. Consider using low-dose aspirin if your doctor recommends it, as it can significantly reduce the risk in some groups.
Are you implementing these protective strategies in your life or neglecting your gut defense? Rebirth. How to turn fear into power in the fight for your health. The knowledge you've gained today isn't just information, it's a transformative power over your health. Recognizing the early signs of colorectal cancer can literally save your life and that of your loved ones. Thousands of Americans are alive today because they recognized these signs and sought medical help immediately.
The difference between a stage 1 and stage 4 diagnosis may simply be the time it took you to act.
Courage is not the absence of fear, but the determination to face it when your life is at stake. Don't let embarrassment, denial, or procrastination rob you of the opportunity for an early diagnosis. Share this information with friends and family, as life-saving knowledge deserves to be spread. If you've recognized any of these signs in yourself, make an appointment with your doctor today, not tomorrow. Remember that 90% of colorectal cancer cases diagnosed early result in long-term survival. The same disease diagnosed at an advanced stage has only a 14% survival rate at 5 years. The power is in your hands to turn frightening statistics into a personal story of successful prevention. Your body talks to you every day. The question is, are you listening to your messages? The life you save by paying attention can be your own.
There is no more precious gift you can give to those you love than proactively taking care of their health.
Make a commitment today to listen to your body, recognize its signals, and act without delay when it asks for help.